Good afternoon, everyone. Thank you for joining us here today with Dr. Louis Al-Faraje. We appreciate him taking the time to be with us as well as you. Please don't forget to check out our YouTube channel, youtube.com/ICOI Dental, where you can see this recording as well as any others that have happened and any future ones as well. Also watch our social media and our website for any updates on events and upcoming webinars. Without further ado, I just want to introduce Dr. Louis Al-Faraje. He is a private practitioner as well as the founder and director of the California Implant Institute, which offers continuing education through advanced surgical and prosthodontic programs, including a master's program and live patient surgical externships. Since 2001, more than 2,000 dentists from over 20 countries have received training at the Institute. He is also the founder of Novadontics, an all-in-one implant practice management platform. Dr. Al-Faraje studied dentistry at the Kiev Medical Institute and at Loma Linda University in California. He is a fellow of the American Academy of Implant Dentistry and a diplomate of the ICOI and the American Board of Oral Implantology. Dr. Al-Faraje lectures nationally, internationally, and authored 4 Quintessence Implant Dentistry textbooks. Dr. Al-Faraje, thank you for being here today.
Thank you, Tara, for the introduction.
You're welcome.
Dear colleagues, it's a pleasure to introduce Novadontics to you and to be with you on this weekend. We'll try to wrap this up in about 1 hour. This is an informative program. Would like to show you a better way, a much better way, doing the clinical aspect of your implant patients in your practice with the Novadontics technology. Novadontics is a cloud-based system. Here we go. It's not. All right. It's a cloud-based platform. And so what cloud means, you can log in onto the software from anywhere as long as you have internet connection. You do not need a server because everything is being backed up on the cloud. In this case with AWS. And then there is no upgrades needed because automatically you get them once they are released every 3 to 4 months. And the support also included. This is what subscription-based softwares in general means, especially the cloud-based ones. It offers a full version on mobile devices, in particular iOS devices. So the iPhone and the iPad. And it goes beyond being a practice management software. Beside that obvious part of the company, if you will, it offers very powerful continuing education through collaboration with Quintessence Publishing. It offers online and in-office access to expert support. And of course, it offers also a very good savings through its marketplace, through its catalog. Over 60 vendors are now part of the Novadontics marketplace. So I'm gonna go, obviously, mainly cover the patient management aspect that is implant dentistry oriented. And we will, if there is any questions, I would love to answer them at the end of the presentation. Very quickly here, this slide shows you the 4 areas that Novadontics covers: practice management, supply catalog, continuing education, and in-office and online support when you need it for certain cases that you might think you need help with. Over 700 users as of today, and the company been in business for 5 years, but the practice management portion, much less than that. The catalog was the first to be released to the market 5 years ago. So you can go to novadontics.com for any information about this platform. However, once you are a member, a subscriber to this platform, you will be going to novadonticsllc.com and you will be logging in. Again, you can log in from anywhere in the world with internet connection on using a desktop or iPad or iPhone. So what I wanted to cover certain things that in particular the implant patients will benefit the most of. The implant dentist will be benefiting quite a bit. So I'm going to click on a patient. Of course, all these patients are fake patients for HIPAA purposes. And I'm going to search for a patient. And here we go. I'm accessing the file for this patient, Ilea Jones. And I'm going to touch up on a few things in the next 45 minutes to show you how this will elevate the standard of electronic medical record keeping in your practice. So first thing first, this is the patient information and the health history. And even this that is fairly basic should be for all softwares. However, we definitely did lots of improvements to existing systems. So even here we have many things that other softwares or other platforms or other patient management systems do not offer. So I'm not going to cover the things that you're familiar with or other softwares offer. However, even here, what we did, since this is, again, implant dentistry oriented, although as a general dentist, you can use it just fine, but definitely you will get the most out of Novadontics if you are an implant dentist. Not necessarily you place implants, but even if you restore implants, you will benefit from. So chemotherapy, for example here, if the patient is on chemotherapy, you can see here there is an I in a circle, I meaning more information available upon request. And here, if you click on it, Novadontics tells you what is the proper protocol to follow in dealing or in treating patients with that are currently on chemotherapy. So there is probably over 200 I in a circles throughout the software that will make sure I mean, the goal here is to standardize the implant treatment in the office. The goal here is to minimize the complications and to elevate the care that all implant providers will be giving for their patients. So let's scroll down more, and let's say the patient is diabetic. Then again, you click here on the diabetes, and again, Novadontics tells you exactly what is the protocol, the consensus in the implant community right now in treating patients with diabetes. So this is of a great help, especially for novice dentists entering the world of implant dentistry. Another popular problems or medical problem that we encounter is treating patients on bisphosphonates. And that's questions that I get almost on daily basis. Again, you click here on I in a circle, and Novadontics tells you exactly per the consensus of the American Academy of Implant Dentistry, the ICOI, the AO, what is the latest in dealing with patients on bisphosphonates when you are about to do implant therapy or bone grafting for these patients. So again, this is only one of the 20 or 20 things that no other software currently in the world offer for implant dentists. And implant dentistry is obviously more sophisticated and requires more data to be collected for proper treatment planning and execution of these implant-related procedures. Another thing I want to show here, that the software provides you with a place to enter the patient's blood pressure, systolic, diastolic, and then the pulse oximeter. If the patient is diabetic, then you have a place where you can enter the most recent fasting blood glucose level, the hemoglobin A1C level. If the patient on blood thinners, in particular Coumadin or warfarin, in other words, you have the chance to enter the INR number, and also maybe not many clinicians are using the PT time, but nonetheless, you are able to do that. So as you can see here for this patient, for example, we have already blood pressure, pulse, and oximeter reading. Let's say she's diabetic, you have all these numbers. So I'm going to go ahead and change some of these numbers. And you do not need to memorize the existing numbers. So let's say the patient came after 6 months, and now you are doing all these numbers. It's important as an implant dentist to take all these readings. You are not simply doing Invisalign or tooth whitening treatment. Here is a different story. You might be doing a big surgery for the maxilla and the mandible, and we need to establish a baseline for these vital measurements. So it's very important to take this more seriously than if you're doing fillings or whitening or simple extractions. And you must collect all this data, if applicable, all these numbers, and to establish that baseline, and then every 6 months or before any major procedure to take all these numbers again. So here, one more time, I'm changing these numbers, and I'm gonna go ahead and save. Of course, none of you remembers the numbers that they were there, and that's not important because now we have an icon you can see in red color. It says vitals. I'm gonna click on it, and here you can see that the software is tracking all the measurements that they were collected. And in this case, I mean, there's a timestamp, the date and the time. As you can see here, today is 2nd of October at 12 o'clock and 12 minutes p.m. Standard Pacific time, because this is getting from the computer time. And then you have all those measurements. I did change some of them. And you can see the ones that are out of normal range are in red color. So now, this is very nice because there is no way for you to remove all numbers. If you did any mistake, you simply will take the measurements again. But this will track all the vital measurements that are done for this patient. And if somehow you don't remember what is the normal range, no problem. You have another eye in a circle. If you click on it, Novadontics will tell you what it considers the normal range for all these 1, 2, 3, 4, 5, 6, 7, 8 vital measurements. And in order for you not to argue with these normal values, if you will, or normal ranges, you can see where that data was collected from, and all that available to you with a click of a button on the information button to retrieve more information about this particular issue. This is always being constantly updated. So you have the latest, what is in the literature or consensus of big organizations like the ICOI, the AID, the AO regarding the medical and dental issues related to the implant dentist in particular. So this is the two things that are different that will definitely elevate the standard of your medical records for the patient. And that would lead to a better care because when things are out of norm, obviously you have red colors and you have more information to read. So this will help definitely elevate the standard of care in your practice. Another thing very important is collecting enough data when we do full arch implant dentistry or even single implants if you really want to be very thorough with your data collection. So here we're going to click on the photos. And again, Novadontics here provides you with a framework for entering the necessary photos for proper patient evaluation. So not simply a place where you can throw photos in there, but it tells you exactly what photos we need and where you should place them. So for example, here, it tells you that we need to collect those 11 photos and a 1-minute video, or you can do longer than 1 minute, but 1 minute would do to evaluate the smile of the patient during speech, laugh, etc., with a live recording. So for example, here it says full face frontal, no smile. And to be clear, you click on eye in a circle, and Novadontics, it tells you exactly how the photo should look like and what is the camera setting, what is the instructions to the patient, where you should be focusing on, and what we evaluate on this photo. For example, on this one, we evaluate the facial proportions, face symmetry, lip characteristics, and shape of face. And of course, when you upload a photo, you have a timestamp, and there's no limit on how many photos you can upload per category. Because you can keep scrolling. After a few photos, you can just scroll through these photos you can delete or add as desired. And if you're using the iPad to take those photos, then immediately from the iPad camera, the photos will be populated here. Otherwise, for the web version or the desktop version, if you want to call it, you would have to obviously click here and then go to where the photos are and get that photo from where it is located, desktop or C drive, etc. So again, this is you collect all the proper photos for the patient, and that would also that's a way to improve not only the electronic medical record keeping in your office, not only to help you being more organized, but more important to help you to do proper diagnosis, not to miss any data that you need to collect in order to do proper diagnosis. So look here, for example, mouth in repose. One photo would do for this lady because she's showing a millimeter or so for her incisors. The incisor display on the mandible is ideal. On the top, she's showing 1, 2, 3. So one photo would do for her. However, if the patient has negative display, then incisor display, then you would need to put the perioprobe on the incisal edge of the teeth for the upper, for the lower, for this lady who does not show any incisor display during repose, etc. So you might need to collect more than one photo per category. For example, if the patient using dentures, partial or full denture, if it's removable, almost all photos would have to be taken with and without the dentures. And that all that tells you, Novadontics tells you that in the instructions. Look here, if patient wears removable dentures, then take one photo with the dentures and one without. So, so this is another way, not only to get you more organized, as I said, but to help you do a thorough data collection for proper diagnosis and accordingly proper prognosis or more, high percentage of success when you are doing proper diagnosis and you have all the data. So your decision making for the patient is more informative and would lead to less complications and mistakes during the treatment planning and execution of the intended procedure. Another another example on how the system is beneficial is I created here an icon, and it's called checklists. When you click on it here, you have over 30 checklists, because it says here 21, but some of these checklists contain multiple checklists. And example, I want to give here a couple of examples very quick. If you are novice to implant dentistry and you are new to evaluating CT scans for implant therapy, so you can click here on CT scan evaluation checklist, and the software tells you what you should be evaluating on the CT scan for the posterior mandible, for the anterior mandible, for the posterior maxilla, for the anterior maxilla, and then in all regions, what you should be looking for. So following this checklist will ensure that there is absolutely no anatomic landmark left unchecked, unevaluated, and accordingly, you will be doing much better job getting all the data required in your head, not only in writing in the software, because you will check these marks once you definitely went over them on the CT scan. And when you save, when you go back to that checklist, you will see exactly what you evaluated so far, or what did you miss, etc. This is of a great benefits. This might be a simple checklist, but then let's go to another one. For example, the sinus lifting through the lateral window. If you click here, you can see on the bottom, we have 1, 2, 3, 4, 5 different checklists inside the sinus lifting through lateral window checklist. So here, evaluating CBCT scan before sinus lifting through a lateral window. And you can see here, we have 7 anatomic landmarks that should be evaluated before doing sinus lifting through lateral window. And some of these landmarks might present contraindication for the therapy. So it would help you not to get at first place into this procedure because it's a high risk or there is contraindication that you might overlook otherwise. Again, this is in particular great if you don't have a very big experience in certain procedures. What to do, what to look for in your first 5 to 6 sinus lifting through lateral windows. You need very easy scenario when you're starting doing procedure for the first time. The first 4 or 5 times you do it, or maybe more, you need absolutely best possible scenario. This way, the chances of success is much higher, and definitely that will build confidence, and you will be able better later on to deal with situations where the conditions are not ideal, but you have already some learning curve, and you will be able to deal with much better with scenarios where the conditions are not ideal. When to peel the window, the lateral window versus pushing it to the inside, you have those parameters there. What to do to minimize the Schneiderian membrane perforation. Again, you should go over that. And you see, a checklist is something you should go over before you are doing the procedure, because during or after, it's going to be a little bit too late, and now you're going to refer to the complications procedures. You have to go over this before. And let's say you're doing sinus lifting through lateral window for the first 5 or 10 times. Would be nice to go very quickly over these 5 checklists, and that will definitely help you to do a better job, and it will help you to shorten your learning curve and the possibility of complications when you are more or less novice or with little experience with these procedures. But even if you're experienced, going over these and checking all those check boxes, ensuring that you went over all these, that a proof of a very thorough, careful approach to procedures, that most of which are complicated comparing to general dentistry, for example. You do not need the checklist to do a filling. You do not need the checklist to do a crown, obviously. Implant dentistry is a different story. You want to do a good job. You want to have a short learning curve. You should put more time into collecting, first of all, all diagnostic data that is pertinent to whatever procedure you're doing, and then taking the time to evaluate all those diagnostic data that you collected, from CT scan to diagnostic casts to photographs to health history to medication history, etc. And that would definitely lead to a quicker learning curve. There's learning curve no matter what you do, but this definitely will ensure that you have a better outcome, more success with the implant dentistry procedures. So again, there is over 30 checklists here that took me 25 years probably of experience. I started implant dentistry in '96. We are in 2001. So a quarter of century of doing lots of implant procedures and different systems and different approaches, different loading protocols to get to this that I collected for you. All right, so this is a checklist that is, again, implant dentistry oriented, that will help you with your implant dentistry portion of your practice. I want to show the way we record the clinical notes in Novadontics. Currently, the way you write your notes, either in writing or what you do, you go to the practice setup on your current softwares. Most likely you click on clinical notes and you will add any notes you want, which you can do the same here. And then when you see the patient, and you're done with the procedure, usually you go and you select one of the pre-made notes that you created, and then you will select one of them and you will modify. This is extremely weak way of doing clinical notes. This is probably 1980 technology, and I don't think this is appropriate for implant dentistry because, again, it might be good for to record the tooth whitening or Invisalign procedures. This is a different story here. So look at how sophisticated this one is. And it's very quick at the same time. So I'm going to go to, let's say this patient is done with implant placement. So I'm going to go to the clinical notes and I'm going to click on add a note. And as I said, you're welcome to go by the way you're doing it right now by selecting a pre-made note from the notes that you pre-made, the existing, and then once you click on it, it will appear here and you will modify as needed. Again, you're welcome to do that, but I think there is a much better way. And so here you have, when I clicked on the clinical notes, you have the date of birth, allergies, medical conditions, automatically populated here from the patient's health history, because obviously connected. You will select a provider. I'm going to select myself here, and then you select the assistant or the two assistants that did help you during the procedure. But now you can select what kind of monitors you used. You can select what type of anesthesia you used. For example, local and nitrous, or maybe you did, of course, topical, maybe sedation. And then if you did IV sedation, you have here a quick ASA physical status that you can select from. If you click on IS circle, that reminds you with ASA, the American Society of Anesthesiologists status. Airway class, you have 4 classes. This is a quick reminder of Malpathy, if you will, score. Now, you can record any pre-medications that you give to the patient. And I'm gonna put here Halcyon, which is very popular, 0.25 milligram. And then I'm gonna put here 2 tablets. And obviously oral, I'm gonna add, you can add more. For the anesthetic, I'm gonna put Lido. I'm gonna put 1 to 100,000 epi. And then the amount, I'll put 4 carpules. And let's say it was inferior alveolar nerve block. You can add more anesthetics. I usually use 50% Lido and 50% Marcaine for most of implant procedures. Here you can record and choose what kind of incision and flap for the maxilla, for the mandible, usually mid-crystal, with mesial release, distal release, maybe also midline, depends on the alveolar bony height. And then I want to show you how nice it is and how thorough it is to record the implants you did in your office. So for this patient, currently, how do you record the implants? You simply take the sticker from the package of the implant and you put it in your chart. This is extremely weak because there is not much data on that sticker. You have the diameter, the length, the brand, and the reference number and the lot number, and that is it. So 5 pieces of information, not enough. So this one here, we have much more data, but it's extremely quick. So for example, I'm gonna act here that I did implant number 4 and number 5 for this patient. So I'm gonna choose location 4, which is 1.5 for the international, and then the brand. So I'm gonna go here, for example, and select Noble Biocare, replace conical connection. For the surface, I'm going to put obviously Ti-Unite. The reference number, that's the only thing you have to type. And the lot number, you have to, just in case there is FDA recall. But then the rest of the fields, same thing. Everything is drop down menu. So I'm going to choose 4.3. I'm going to choose 11.5 millimeter long. Surgical protocol, you have only 3 choices, right? One stage, 2 stage, and immediate loading. I'm going to put here 1 stage, healing abutments was placed. So bone density, you have only 4 choices. I'm going to put D3. Osteotomy site, you have only 4 choices. I'm going to put extraction with bone graft. Initial stability, I'm going to put 40. ISQ, if you have the Ostel or Penguin machines, I'm going to go here and put, let's say, 75 for buccolingual, and I'm going to put 70 for mesodistal. Implant depth, I in a circle. What I mean by it, implant platform depth relative to mid-buccal crystal bone. We're going to choose -0.5 millimeter, which is the right thing to do, 0.5 to 1 millimeter below the mid-buccal crystal bone for the platforms which design implants, which is the case with most of implants these days in the market. Loading protocols, you have 3 choices. I'm going to use the conventional loading, so more than 3 months. I want to wait. And then this is very important, recommended restoration phase start date. So I'm the one who placed the implant. I just placed it. So I perfectly, right now, I mean, tomorrow I might forget, but today I know probably when is the best time to go back for this implant to restore. So I'm going to put here, let's say 4 months from today. So I'm going to go to January 2022. And let's say on the 12th of that day, I can add a PA X-ray. I'm gonna click on add, and as you can see here, we have 16 pieces of information about that implant. Of course, I'm explaining now. It took like 2-3 minutes, but if I'm not talking, this is literally 20 to 30 seconds. And I will be recording 16 pieces of information about this implant. But now, this is implant was number 4. Let's say I'm adding number 5. I'm going to click on duplicate, and then I'm going to edit this one, change only number 5. And let's say the initial stability was 45 on that one. And that one ended up with being -1 millimeter below bone. And the reading slightly different on the ISQ unit. Save. So here you have it. You can record maybe 10 implants in 5 minutes, and with much better way than what you are doing it now. So now that these implants are recorded, you like it or not, all that data went to the implant logbook. So I'm gonna go ahead and save this clinical note, and as soon as I save it, you see, I forgot to put the time, so it makes me put the time. So the procedure was at 10:30 a.m. So now, as soon as I save all that, if you click on implant logbook, that data it went to implant logbook, and as you can see here, the first 2 implants on October 2nd, Ilea Jones, and you can see all these came to the implant logbook. This is of great importance because now you can see in the logbook the total implants placed in your office. For example, on this demo account, it's 105 implants already placed. And you can see the success rate. It says here 98.1, meaning some implants were removed because they did not also integrate, they failed, whatever the reason is. So let's say the implant number 5 that I just placed failed. I'm gonna click on edit, and I'm gonna put here that I removed the implant, you know, on the 12th of this month, and the reason was you have here a drop-down menu of all possible reasons why you want to remove an implant. So let's say overheated bone, it was bone necrosis, and as you can see here, once the implant is removed, the success rate did change, and the whole line became in purple color. So quickly you can spot implants who were placed, but then later were removed for whatever reason. So if you click here on the implant logbook instructions, you can see the different ink colors, if you will. Red means the implant is ready to be restored. So at a glance, your front office can see what implants are ready to be restored, and they will call the patients for restoration. Once the implant is restored, once you start the restorative process, I'm going to click on edit, and I'm going to put we started the restorative process. Now you can see the ink here is not red anymore. So you have purple for implants that are removed, failed, and then red for implants ready to be restored, black for implant already started the restorative phase or not yet due for restoration. And then you have a blue color, and that's for implants that entered without the patient having a file in Novadontics, meaning you can subscribe only to the implant logbook if desired. So you click here on add an implant, and you can add an implant in the implant logbook without the patient having a file in Novadontics. So these implants will appear in a blue color to tell you that those are not a native patient to the implant platform, to the Novadontics platform. So everything would be in blue if you are using only the implant logbook, but they can be in purple or red, depends on where you are in the restorative phase and if any of them failed or not. So this is extremely powerful tool to track the implant activity in your office, the success rate in your office, and you can run statistics. So if I put here 4.3 millimeter, you can see here 13 implants only out of the 105 in this demo account were 4.3 millimeter diameter. If you're using more than one implant system, you can also run a report showing only the Nobel Biocare brand versus Zimmer brand versus Straumann brand versus Neodent, etc. if you have more than one system in your office. So this is very powerful tool, and we're building one just like it for bone grafting that will be ready by the end of the year to track all the bone grafting procedures in great details that you are performing in your office. So it would be extremely similar for bone grafting procedures. Again, this can be a standalone feature that you can subscribe to or part of certain plans in Novadontics software. So another thing very important I want to cover, if you are working on this patient and somehow you think you need help, you will click on consults. You will choose mandible, maxilla, both arches, or medical conditions. I'm going to use the maxilla I need help with. You're welcome to write any notes, and then you will choose one of the consultants currently that are provide consultations. You know, have a periodontist, endodontists, prosthodontists, pharmacologists slash dentist, and ENT. So it depends on the help you need. You can select a provider. I'm going to use Dr. Mamali Rashad here. I need his help. These are the consultants that are currently a part of the development team with Novadontics. So now I selected Dr. Rashad. I want to have consultation with him. There is a fee to pay for that, which is $290, and you can spend up to full hour with Dr. Rashad or with any other consultants, depends on your desire for your need for the case. So you can share files with a consultant or with a colleague. You simply search for the consultant or for the colleague if they are subscribers. If they are not, we can give them access where they can view only, and there is no charge for any colleague that you want to have Novadontics for the purpose of sharing files. They simply cannot add new patients. You can select what part of the file you would like to share with your friend. colleague, and then what type of access you want to give them. You must check the box that the patient did consent for you to share their data with a fellow a dentist or maybe an MD, and you submit. And now this consultant would have that note was this patient already shared with that doctor. But you got the point here that you can very easily in a HIPAA compliant environment be able to share this data. Of course, not even 5 hours would be enough to cover everything the software does, but it provides electronic prescription capability in collaboration with DoseSpot, software. We have also a cloud-based imaging solution that works with any sensor available in the market for having all your images on the cloud. And there is e-claim capability in collaboration with the Change Healthcare System through their Dental Connect portal. And of course, period chart, endo chart, and all other usual features for general dentistry that are available in other softwares. As I said, we have a catalog, over 60 vendors that offer DSO level discounts. So even if you are not a member of a DSO, you can enjoy prices that in most cases as good as DSO prices for you as an individual dentist. So you are able to compete in this world. This is of a great value because you definitely can save lots of money. Very simple here. I'm gonna click here on say I'll choose I'll choose Noble Biocare, and let's say I want to buy an implant. You click here and you click here, and you can see the prices. You add to the cart. This is the cart. You can remove or save for later or subscribe for monthly automatic shipments. You choose your address, you choose method of payment, and it's exactly, if you will, the dental Amazon version. We have very powerful continuing education in collaboration with the Quintessence Publishing, where you can, this is not only for implant dentistry, but for also general dentistry, because all these live lectures from best speakers in the world cover almost all disciplines in dentistry, from bone grafting to oral surgery to prosthodontics to orthodontics, periodontics, digital implant dentistry, photography, etc. So probably most of the lectures are implant dentistry oriented, but they do cover actually a wide aspects of dentistry, and you can watch only, or let's say full arch implant dentistry. We have all these lectures, so you can watch only, or you can also request a CE, where you automatically, when you request a CE after watching a program, you will get 10 questions. You must answer 7 correct to get 2 hours of CE per lecture. Last but not least, we have the in-office support, where you can request help in your office, and the fees that the Novadontics freelancers are listed here for what they would charge you to show up in your office, supervise you, hold your hand, or simply do the procedures while you are not even in the office, if that's what you need. And you can track the requests that you made, and just like you can request the consultations that you initiated through the system, which one's still pending, closed. And of course, the software provides you with dashboard where you can follow all the spending and the CE credits and the patients follow up with your marketing dollars by seeing how the patients are hearing from you, what is the marketing source of all patients showing up in your office, and provide you with at a glance charts and pie charts that will help you track quickly different type of activities in your office. More information available on Novadontics.com, where you can see the current plans available to subscribe. Free trial period with no obligations is available. And that's probably a quick overview about the Novadontics platform and the new technology that implant dentistry oriented for better medical record keeping and for better outcome of the implant procedures in your office for less complications and better success. Of course, there's more we can cover here, but I think this will give you a good perspective on this new technology that we are introducing to the implant world. All right, so if there's any questions here, well, this is being recorded, so it will be available on YouTube, and you can call the 800 number of Novadontics for any questions or request a demo, if you will, by clicking here, and you can schedule a demo with one of the Novadontics representatives for more information.
Thank you, Dr. Al-Faraje. To click on that demo, we can't see your screen anymore. Is that something that's right on the homepage there?
Let me see, can you see it now?
Yes, we can.
Yes, so we have a button here, schedule a demo, and when you click on it, you can schedule a full 30-minute demo or simply a phone call with one of the Novadontics representatives to go over certain aspects, or to answer any questions, or to initiate a subscription or a free trial period with Novadontics.
Great. Thank you so much for your time today. We appreciate you sharing that with all of us. I know one of the questions we did get was this recorded, which you've already addressed. It is being recorded, and it will be available on our YouTube channel, youtube.com/ICOI Dental, in about a week or so. Thank you again for your time.
Thank you, Sarah. Thank you, the ICOI, and looking forward to seeing you in the future for more webinars in the implant dentistry topics. There is 2 already I've done for the ICOI, again available on the address Tara mentioned on YouTube, and I look forward to meeting you in the future.